All right, good evening, folks. Welcome to USMLE videos. This is Dr. Paul. Thank you for tuning to our channel today. And today I would like to discuss this question. This is for step 1, step 2, and even for step 3. Okay, let us see this question. Taylor is an 11-year-old boy brought to your office by his mother because his teachers at school reported that Taylor has trouble holding attention on tasks. He does not seem to listen when spoken to directly. He interferes with other students unnecessarily, even after being warned not to do so. He fails to give close attention to details. He frequently leaves his seat to go out of the classroom. He blurts out answers before the teacher finishes asking the question. He does not wait for his turn. At home, his mother noticed that he is easily distracted. He does not sit quietly at the dinner table. He stops eating one dessert and goes for another dessert. He taps his hands and feet if he has to sit in one place for more than a minute. In the physical examination, you notice a very talkative child, not able to sit properly in one place and very fidgety. Which of the following is the first line treatment for his disorder? So, the choices are A. Cognitive behavioral therapy, B. Atomoxetine, C. Bupropion, D. Methylphenidate, E. Clonidine. Okay, so choose one of the 5 choices. First of all, what is this disease? You are looking at an 11-year-old boy and his teachers are complaining. They are saying this boy has trouble holding attention on tasks. He does not seem to listen when spoken to directly. He interferes with other students unnecessarily. And he fails to give close attention to details. He frequently leaves his seat to go out of the classroom. He blurts out answers before the teacher finishes asking the question. He does not wait for his turn. And also his mom noticed some symptoms at home. And she says at home, his mother noticed that he is easily distracted. He does not sit quietly at the dinner table. He stops eating one dessert and goes for another. So he starts eating ice cream and he stops eating ice cream. And then he go for some other thing. Alright, so he is also a very talkative child with little substance. And in the physical exam, he is also very fidgety, like using his hands like that. So whenever you see that word fidgety, it's a very good sign of attention deficit hyperactivity disorder. Okay, remember that. So this is attention deficit hyperactivity disorder. Let's go by the choices. Number 1, cognitive behavioral therapy. Now, cognitive behavioral therapy is great. They analyze what thinking is influencing your behavior, what exposure is influencing your behavior. So, cognitive behavioral therapy is a great thing. All right, studies show that CBT can be one of the most effective psychological treatments for ADHD. But it is not the first line treatment to ADHD. The first line treatment is a stimulant like methylphenidate or Adderall. Okay, so the first line treatment is always a stimulant. The stimulants, which include methylphenidate and amphetamines, are considered first line therapy because of their rapid onset of action and efficacy. Then atomoxetine. Atomoxetine is a norepinephrine reuptake inhibitor used as second line medication or as an adjunct treatment with the stimulants. But atomoxetine takes 2 to 4 weeks to act, and also it's not a stimulant. That's why a lot of people don't like it, but it is still effective. I know people who take atomoxetine. I also prescribed atomoxetine to many people and they said it works very good. So I highly recommend atomoxetine, but still it is not the first line treatment for the examination purposes. Okay. Then bupropion. Bupropion is an antidepressant with dopaminergic and noradrenergic activity. It is not as effective as the stimulants to control the symptoms and signs of ADHD. Then there is clonidine. Clonidine, an alpha-2 adrenergic agonist, is second-line option. It can be used when stimulants are refused or have no role. For example, if somebody says, "Oh, I don't like any stimulants; they're abusive, and I don't want to dependent on stimulants," then you can try clonidine. You can try vanfacin. You can try atomoxetine, bupropion as second-line options to many people. So that is about ADHD treatment. ADHD is subdivided into three types: inattentive type, and hyperactive impulsive type, and then there is the combined type. Okay, there are three subtypes of ADHD, and DSM-5 has criteria. You should have symptoms for at least 6 months or more, and at least in two settings like a home or a school. Okay, if you have symptoms at least if you have symptoms only in school, that's not enough. If you have symptoms only at home, that's not enough. You should have symptoms at home and at a school or some other places. So the criteria says two settings, two or more settings. And also the symptoms must have been present before the age of 12. Okay, so the symptoms must be before the age of 12 for in two more or more settings for 6 or more months. So that is the criteria. Remember that 6 to 12. That is how I remember it. 6 to 12 for 6 months in two settings for that symptoms started before the age of 12. So that is the DSM-5 criteria. You need that. Okay, and when you have you don't say like, "Oh, I don't have attention. Oh, you have ADHD. Take Adderall." You don't do that. You need to go by DSM-5 criteria. If it is the inattention, you need to see what kind of symptoms. You need 6 symptoms, 6 or more symptoms from that inattention class, like patient is not listening, patient is not focusing, patient is not doing his homework, like that. And also hyperstimulant class, 6 or more symptoms from hyperstimulant and impulsive character, like patient is running all over the place, he is fidgety, and he is not listening to the demands you are making on him, he is running from one task to the other. So these psychomotor activity in 6 or more areas are also needed in order to make this diagnosis. Okay folks, those are the important points I wanted to share with you on ADHD and treatment. Please visit our website www.sopertestscores.com. Okay, sopertestscores.com, this website. I started a blog and I am posting a question almost on a daily basis. So read these questions so that you can get a very super score on your exam. Okay, follow each question carefully, because I am making these questions exactly on USMLE basis whenever I get some time between seeing patients. Okay, so follow these questions and I hope you get a great success in your exam. Thank you. I will see you in next video.